Welcome to RAAONLINE. I am Dr. Sudakshina, Professor of Anatomy. Today we will be discussing on the part specific, that is the posterior triangle of the neck. It is an essay question in all universities and it is a very important topic. The essay can be clinical case-based essay, like they can give you as a swelling in the posterior triangle of the neck and they can ask you where is the posterior triangle of the neck situated, what are the boundaries of the triangle, what are the divisions of the triangle, what are the contents of the each divisions of this triangle, and what is the clinical anatomy associated with it. So I am directly coming to the essay as such, the posterior triangle of the neck. Now where is it situated? The posterior triangle of the neck is situated behind the sternocleidomastoid muscle. Yeah, the boundaries of the triangle include anteriorly the posterior border of sternocleidomastoid muscle, posteriorly the anterior border of trapezius, inferiorly we have the the middle 1/3 of the clavicle, which will form the base of the triangle, and apex it lies on the superior nuchal line where the trapezius and sternocleidomastoid muscle meet. So let's see the diagram to understand the boundaries of the triangle. So you can see over here we have the anteriorly, this is the sternocleidomastoid muscle. So the posterior border of sternocleidomastoid is forming the anterior boundary of the posterior triangle. The posterior boundary is being formed by the trapezius muscle, the anterior boundary of the anterior border of the trapezius muscle, and these are coming very close at the superior nuchal line because here is the mastoid process from where the sternocleidomastoid is taking origin, and the base of the triangle is being formed by the middle 2/3 of the clavicle, actually the middle part of the clavicle. And you can see over here the clavicular head of the sternocleidomastoid, and this is the that is the sternal head of the sternocleidomastoid. So that's why the name of the muscle is like that. So these are the main boundaries in the posterior triangle. Definitely we will be talking about the floor, the constraint of the floor muscles, and also the roof next. So once we have seen these boundaries of the posterior triangle, anteriorly the posterior border of sternocleidomastoid muscle, posteriorly we have the anterior border of trapezius, inferiorly the middle third of the clavicle, and apex it lies on the superior nuchal line where the trapezius and sternocleidomastoid meet. So these are the boundaries of the posterior triangle of the neck. Coming to the roof of the posterior triangle, the roof of the posterior triangle is mainly formed by the investing layer of deep cervical fascia. We know all the layers of the deep cervical fascia and the modifications. So investing layer is something which is like a collar which surrounds the neck, and it is also the roof of the posterior triangle. And there is also a superficial fascia over the posterior triangle which contains the following structures. We have the platysma, which is a muscle which is extending, superficial muscle. Next we have the external jugular vein, which is an extremely important structure in the roof of the posterior triangle. Then posterior external jugular veins, parts of cutaneous nerves which are supplying the skin over the posterior triangle, and cutaneous nerves from here which originate and goes and supplies the various parts of the scalp and also the angle of mandible, the lymph vessels and the arteries. So to coming to the roof per se, this is the diagram of the roof. This is the base of the mandible, angle of the mandible. Here comes the mastoid process where the sternocleidomastoid muscle is over here. So this is the sternocleidomastoid muscle, we can see over here. So to write it over here, this is the sternocleidomastoid, we will write it as SCM. So this is the sternocleidomastoid muscle. Okay, and here we are having the trapezius muscle. So trapezius, so this is the trapezius, so this is the posterior boundary of the posterior triangle, whereas this is the anterior boundary. We are having the posterior border of the sternocleidomastoid. This forms the apex of the triangle, and the lower part is by the clavicle, which forms the base of the triangle. Now looking at the roof, we can see a vein over here on the roof of the triangle, that is the external jugular vein, and it crosses the triangle over the sternocleidomastoid and comes and becomes deep. It pierces through the investing layer of deep cervical fascia exactly over here, and it will drain into the subclavian vein. This vein is of very much clinical significance because of its course. It is more or less straight, and it can be used to measure the pressure in the right atrium. Now coming to the other structures in the roof, definitely the most important structure is the superficial fascia, which will contain the platysma. So platysma is a thin sheet of muscle and which is present on the superficial fascia of the neck. So that is one thing. Secondly, we are seeing some nerves which are originating from the point over here on the posterior border of sternocleidomastoid, and you can see this is the nerves. These are the cutaneous nerves which comes out from this point. These cutaneous nerves which are actually innervating the skin over the posterior triangle. Also it is going over the anterior triangle of the neck and also to the angle of mandible and the scalp. So we have the lesser occipital nerve, the root value is C2, and the greater auricular nerve, which is root value C2, C3. Lesser occipital will go and supply the skin of the scalp behind the auricle. The greater auricular nerve will supply the skin over the angle of mandible and the parotid gland. That is C2 and C3. Next we have two more nerves. One is the transverse cervical nerve, which will go to the other side, counterpart and anastomose, and supply the skin over the neck anterior part. Whereas the supraclavicular nerve will divide into three branches: middle, intermediate and medial, lateral, intermediate and medial, and it will supply the skin over the lower part of the neck and also over the upper part of the chest. So these are the some subcutaneous nerves or cutaneous nerves which are emerging and a content of the roof of the posterior triangle.